What if I told you that a normal blood pressure reading could actually be dangerous for seniors? This sounds surprising, but many older adults are told their numbers are fine while they still feel dizzy, weak, or tired. This creates a serious concern because in some cases, lowering blood pressure too much can be just as risky as having it too high. So what is the ideal blood pressure for seniors, and are you being told the wrong number? What should blood pressure actually be after the age of 60? This question confuses many people because different doctors often suggest different numbers. Some say 120/80, while others believe a slightly higher level is acceptable. And recent medical insights are changing what we once thought was healthy. In this video, we will clearly break down the exact numbers, what they mean, and what is truly safe for seniors. Blood pressure is simply the force of blood pushing against artery walls. The top number called systolic shows pressure during heartbeats, while the bottom number called diastolic shows pressure between beats. As people age, arteries stiffen and pressure rises, so doctors consider step 1, routine, doctor visits. Most seniors start by visiting their doctor regularly to monitor their health. During these appointments, blood pressure is checked, often with readings like 130/80 or 140/90. These numbers are slightly higher than the traditional standard of 120/80. Doctors frequently tell patients that this is just slightly high and not immediately dangerous. On the surface, this seems reassuring. However, many seniors begin to wonder if these numbers are truly safe for them personally. Even though they are told their blood pressure is under control, subtle signs like feeling more tired or dizzy may start to appear. This early stage sets the foundation for the decisions that will follow regarding medication, lifestyle changes, and monitoring. Step 2, medication is prescribed. When blood pressure consistently reads higher than recommended, doctors may prescribe medication. These medications are intended to reduce the pressure on the heart and arteries, aiming for a more controlled reading. Over time, blood pressure begins to drop, sometimes reaching the target number suggested by healthcare professionals. For many seniors, this brings a sense of relief. They feel they are taking the right steps to protect their heart and prevent complications like stroke or heart attack. Yet, lowering blood pressure is not always a simple solution. Each senior's body reacts differently, and what works for one person may not be safe for another. This stage introduces a delicate balance between reducing risk and maintaining overall stability. Step 3, new symptoms appear. After the medication takes effect, some seniors start noticing new symptoms. Lightheadedness can occur when blood pressure falls too low, making standing or walking risky. Fatigue becomes more pronounced, affecting daily routines and reducing energy for normal activities. In some cases, the risk of falling increases, which is particularly dangerous for older adults. These symptoms can be confusing and frustrating because they appear even while following medical advice. Many seniors do not immediately connect these issues with their blood pressure medication. Instead, they may think these are simply signs of aging. This stage creates tension and concern, highlighting that blood pressure management is more than just hitting numerical targets. Step 4, confusion increases. As symptoms continue, confusion grows among seniors and their families. Questions arise: is lower really better? Could reducing blood pressure too much be harmful? Family members often become anxious and begin monitoring their loved one closely. These moments can be stressful for everyone involved, as there is no single answer that fits every individual. This is the critical point where many people realize that traditional blood pressure standards may not apply to older adults. Most people do not understand that the ideal number changes with age. What is healthy for a younger adult may not be the safest option for a senior with different medical conditions, lifestyle factors, or physical strength. It is important to recognize that seniors are not a uniform group. Healthy seniors who are physically active may tolerate slightly higher blood pressure without immediate complications. They maintain good circulation, strong muscles, and balanced energy levels. On the other hand, frail seniors or those with multiple health conditions may experience symptoms from even modest blood pressure changes. Sedentary seniors may face additional challenges as their cardiovascular system is less adaptable. Doctors now consider these variations when recommending blood pressure targets. Personalized care is essential, taking into account lifestyle, activity level, medications, and overall health. What most people do not realize is that there is no single perfect number for everyone over 60. Blood pressure management for seniors requires a careful, individualized approach. Routine doctor visits, careful monitoring of symptoms, and an understanding of one's personal health are critical. Medication should be used thoughtfully, balancing the benefits of lower blood pressure with the potential risks of going too low. Recognizing variation among seniors allows families and healthcare providers to make smarter choices that prioritize safety, energy, and quality of life. Managing blood pressure in seniors is not as simple as it seems. The core problem lies in overtreatment versus undertreatment. On one hand, if blood pressure remains too high, there is a significant risk of stroke, heart attack, and other cardiovascular complications. On the other hand, if blood pressure is lowered too aggressively, seniors may experience dizziness, fainting, and an increased risk of falls. Both extremes can be dangerous, and many seniors are caught right in the middle. Emotional tension rises because every adjustment feels risky. Falls are one of the leading causes of injury in older adults, and even small mistakes in treatment can have serious consequences. So where exactly is the safe zone? Medical research and clinical experience suggest that for many seniors, an ideal systolic blood pressure range is around 130 to 140, depending on overall health. This is not a one-size-fits-all solution. Age, medical history, and how well the body tolerates medications all play a role. In fact, for some seniors, slightly higher blood pressure may actually be safer than pushing it too low. This is why personalized care and doctor guidance are essential. Each individual must be assessed carefully, balancing cardiovascular protection with the maintenance of energy, stability, and mental clarity. This blood pressure range works because it prevents excessive strain on the heart and arteries while still maintaining sufficient blood flow to vital organs, especially the brain. By keeping pressure stable within this range, seniors can reduce the risk of dizziness, fatigue. It is important to clarify that lower is not always better. Stability and consistent readings matter far more than chasing perfect numbers. Seniors should monitor symptoms in addition to numbers, paying attention to how they feel while standing, walking, or performing daily activities. Practical monitoring and awareness help avoid complications that pure numerical targets might miss. The key takeaway is that health is not about chasing perfect numbers. It is about achieving balance. Every senior's body reacts differently to blood pressure changes, so understanding personal limits is critical. Smart health decisions come from knowledge, careful monitoring, and guidance from qualified professionals, rather than fear or rigid targets. The ultimate goal is to stay strong, steady, and independent, ensuring quality of life while reducing the risks associated with both high and low blood pressure. If you found this video helpful, check out our next video on simple daily habits to naturally support healthy blood pressure. Make sure to like this video, comment your thoughts, and subscribe for more health guidance. Take care of your health, and we will see you in the next video.